Here we go, and it's thinking there. All right, here we are, everyone. Welcome to Ask Our Vet, brought to you by Rockwell Pets Pro. Each week, we'll be talking about topics in veterinary medicine and answering your questions. I'm your host, Mike the Voice Monkey, full-time voice talent and 26-year veteran of the veterinary industry. And as always, with me is Dr. Max, 2018, almost said 2008, made you older than you are. A graduate from Tufts School of Veterinary Medicine and full-time veterinarian at the Village Veterinarian in New York since 2020. How are things going, Dr. Max? How are things up in New York these days?
They're good. Can't complain. Thanks for welcoming me to the show. Welcome everyone who's tuning in tonight. It was a snow day here in New York, but that didn't stop all of our patients from coming.
It's not like a Texas snow day, is it?
Oh, very different from a Texas or Oklahoma snow day. Yep. We didn't stop, but our prayers go out to the people down south dealing with all the craziness that's going on right now.
I've got a friend of mine who just moved to Dallas a couple of months ago, and he's texted me today, and he's been without power or water for the last 4 days.
Yeah, that's insane.
Yeah, and he's in an apartment, I think. So yeah, it's
wow.
It's no good down there, but yeah. So yeah, and go ahead.
Yeah, no, I have cousins in Houston. They've been without water for 2 days, and they have plenty of bottled water, but it's when they're going to be back on, and I'm just thinking about them. It's like the South doesn't really know what to do when they get overloaded with the snow.
Well, it's because we don't. You're from Louisiana. It's one of those things where.
Yep.
How does can Ohio handle a hurricane? I mean, it's one of those things that they don't ever get it. Yeah, so we don't get snow. So that's why we flip out, and can't handle it. But yeah, Texas they're in bad shape right now, but that's okay. But I want to let people know who are watching, if you guys wanted to ask questions, either on our topic tonight or any veterinary questions is certainly fine. Go to the Rockwell Pets Pro Ask Our Vets page, and you can register there and ask questions. We'll throw them up on the screen as they come in and answer them as they go. So, Dr. Max, any cool, interesting cases this week? I heard you had a long day today, but anything interesting you guys want to share? Any cool stories you want to share with our audience tonight?
Absolutely. Today was quite a day on a number of fronts. I would say let's start off with Rosie. Obviously, we won't give last name of the client or any of the patient or anything, but this was kind of crazy. It's a dog that has a history of vestibular disease.
Okay.
She's a 12-year-old intact female, like mini poodle. And intact as in reproductively intact for those of you who are joining, just to let it be known. So she has not been spayed, which factors into the story.
Uh-oh.
It's a surprise for later. So she came to our office, I believe it was on Tuesday. She had been there, she's been a long-standing client of our hospital, had some really bad dental disease, and maybe a year ago or so, and we, one of the doctors at our hospital had removed some teeth. Getting a call from Atlanta. I'm pretty sure that's
it's not me. Yeah.
Yeah, no worries. Don't know who Lucy McBath is, but if she wants to leave a voicemail, I suppose she can. So anyway, Rosie, very sweet little dog. She, history of periodontal disease and had a number of extractions in the past, and so she, and also vestibular disease. So that's for those of you who are joining it may not know, it's kind of when your dog's balance is a little bit off. They may have a little bit of a head tilt, be walking or unable to walk, maybe even completely ataxic. And just, kind of difficulty moving. maybe even walking in circles sometimes. And sometimes, dogs can get from like an inner ear infection or some intracranial reason for this. But anyway, this dog has a history of that. Hasn't really had any issues in the past, but she presented to our clinic on Tuesday. It was my day off, for a seizure, just a focal seizure. Had never had one before. This is the first that the owner was aware of. So the doctor who was on that day, assessed her. Cranial nerves and everything were fine. She was doing better when she was in our clinic. I think she had run some blood work to confirm that electrolytes and all that were within the normal reference range, and see if there was an infectious cause, or just get a checkup. It had been maybe a year since the last blood work. And for an older dog, that's definitely a good time frame to be doing things as far as diagnostics. So I came in on Wednesday. I reviewed the blood work because that doctor was not in that day. The owner had called saying that now Rosie was, licking her vulva excessively. And this wasn't something that she had mentioned the day prior. So it must have started as soon as she got home, really. Licking her vulva and some vaginal discharge. So I'm like, oh, okay. This is different from the presenting complaints the day prior.
Okay.
But potentially worrisome, especially because she's not been spayed. And, I think pyometra is a possibility. But I looked at the blood work, and this was usually like a uterine infection, which can be life-threatening. But the blood work was like completely normal. I would have expected a really high white cell count, white blood cells to be high. That wasn't the case. Really, everything was within the normal reference range for Rosie. But I'm like, bring her in. We'll take a look at her. I did so. Her abdomen was a little bit distended. She wasn't necessarily painful, but that was, this is my first time meeting her, but I did notice that. I noticed the mild left-sided head tilt, which is it never really resolved from the vestibular episode when it was most severe. I didn't see any vaginal discharge at the time, but I told the owner these are kind of the things that we can want to rule out. Potentially pyometra. So like X-rays would be a great idea to see if we see any fluid-filled, really large uterine horns in the abdomen. Possibility of she mentioned it was like pink tinge, so maybe like there's a little bit of bleeding. As far as the discharge goes. Could it be, that she's struggling to urinate and having a urolith, bladder stone? We could also potentially rule that out on X-ray. Or UTI, that would also be pretty high up there on a list of differentials. The owner wanted to kind of, go forward with antibiotics for potential UTI, and we got a urine sample from her, very, very pink fluid. Submitted that, and we got those results this morning. So I called her this morning. No bacteria, but there was protein. There was what else was there? Was the urine specific gravity, a lot of red blood cells in there, and a lot of or the urine specific gravity was pretty low. So that's, for those of y'all who may not know, it's kind of the concentrating ability of the kidneys was a little bit impaired. And so I told her these things can be, I would expect bacteria for sure. Most most likely for a pyometra in the blood, high white count, bacteria in the urine, but that's not the case. But there's still something going on, and she's not really wanting to eat so much. So I'm like, bring her back. Let's just do these X-rays. So we did them. Lo and behold, really, really big uterine horn, and also mass in the abdomen. So we did kind of like the exploratory I wasn't on surgery, but I was able to watch the doctor who went in for the exploratory laparotomy to look in the abdomen, and so it was a really, really fluid filled uterus, but hydronephrosis, so like kind of water and fluid, but no pus.
Well, that's
My
no
blood
fun.
cells.
Yeah.
So still, it was like about to rupture. This thing was huge, and there was coincidentally a uterine body mass that they're going to send out for biopsy. But she's been spayed now. She's, she was extubated well, recovering well. We got that out of her. She lost I think a pound in the process. I mean, it was heavy. She was only a 6-pound dog. So,
wow.
Really grateful to have gotten that out of her, and grateful that the doctor had time in his schedule with his slate of surgeries today. But that was really exciting, and not a completely obvious. A lot of the times we see dogs who are, a Labrador Retriever was outside in the rain. Next day, scratching his ear, and it's super smelly. External ear infection. Don't even need to do anything. Necessarily. Obviously, there are diagnostics that can and should be done, but you can smell it a mile away. Whatever. This, we really, it wasn't obvious, and it was really exciting to proceed with it, and had a happy ending. So, as far as the type of tumor that is, I guess we'll have to wait a few days to find out from the pathologist, get that report back. But at least for now, I'm really proud of us for having done that and taking care of this little pooch. So that was one of the exciting things today.
See, that's the fun thing, is you get to play detective and figure it out, and
right.
And please, God, people, spay and neuter your pets. If you're not going to breed them or something, it only leads to problems. You have male dogs, you got to neuter them, or they're going to get out. They're going to run out and run away. They're going to get cancer. They're going to get all kinds of issues. Female dogs and cats, they're going to get mammary tumors. They're going to go into heat, and every male dog is going to show up at your house. Then it's just a mess. So it's just spay and neuter your pets, please. Be like Bob Barker.
Hey, I was just about to say that. Yeah, pull a Bob Barker and do that. Apparently, so the owner was from Denmark, and apparently that isn't something that's really culturally normal to do, I guess. And I guess in the UK for sure it is, but maybe not in parts of mainland Europe. It's not as common practice, I guess.
Take that, Denmark. We're better than you in that area. Think you're so high and mighty, Denmark.
Yeah.
So, what else happened this week?
What else happened this week? God. Sometimes I can look through my my photos to see, what else was super relevant right now. I just have this really fluid-filled uterus. That's the most exciting thing.
Nice.
Well,
I bet your wife loved to see that.
Oh, she
hey, honey, look at this cute uterus I saw today. Quit showing me that.
Cute is one way to put it. She has expressly forbidden me from sending, things that may have blood or, discharge or whatnot. So cute puppies are acceptable. Happy, healthy dogs, but no skin or blood or feces or anything like that. So that's taboo.
I've got former coworkers that send me pictures of just them with a tumor, and they go, "Guess what organ it is?" And I have to try to guess what horrible thing they yanked out of some poor dog, whether it's a splenic tumor or who knows what. But it's always gross, and I have a hard time figuring it out with if it's just a tumor. It's like, okay, well, I got no context. I can't tell you what.
Yeah. Well, I guess the other thing that pops out to me, at me from today's slate of patients was actually a patient who I've never met before, which is unfortunately sometimes the case here. An owner of a pet who has come to our hospital before, calling about a patient. The doctor who saw him last or had only seen him, maybe he came only once to our clinic, is not there that day. And so they wish to speak to the doctor. So it was my final call back of the evening. And there's only so much that we can do as far as dispensing medical advice without really having a valid relationship with these patients. But
Right.
it's important to touch base with the client and whatnot. And so like there's this dog Cooper, 6-month-old Labrador, Labradoodle or something. I got a clinical picture from the notes, the soap notes from previous doctor, but I don't know the patient, but the owner's asking about I had presented for diarrhea that has seemingly resolved now, but now it may be constipated, which is kind of a great segue into our tonight's topic, I suppose. But I went over with her some of kind of the basic premises here, and sometimes in treating one thing we may accidentally cause another, or if given too long, or specific drugs may lead to undesirable side effects. And the unfortunate thing that pops out to me from this conversation, I guess with the recency effect in psychology, it being the last one of the day, is that this owner was not so happy. And, of course, it's kind of blaming us for having caused this. And, at the end of the day, like, I try to, handle my emotions. I don't know the owner, I don't know the dog, but, I can give kind of blanket, general, good practice at home therapy, and suggest that this is what can be done until we're able to see your dog next, and it may not even necessarily warrant a vet visit, which sometimes I will preface our topic on constipation is it always a medical emergency? And I would say most definitely not. And from what I could piece apart from what this owner was sometimes articulating very loudly and not so nicely, was it didn't seem that this was an emergent situation, but she was just like very concerned with her dog, and rightly so, it's her baby. But just trying to put everything into perspective. So that was the other thing, besides all the lovely dogs and cats that I saw today, and that really cool, exciting case with Rosie, that's the one that sticks out of my memory, even though I don't even know the patient. So
yeah, we had a lot of that back in orthopedics, where a dog would be limping, and it would be, to the owner, would be an emergent case. We knew it wasn't, but it's hard to convey that in a sense to where, we can't see you right away, it's not an emergency, and they go, but my dog is limping. And a lot of times the next day the dog would be better, just kind of, and if you could tell, if your dog could tell you how he was feeling, like, oh, no, I just tweaked it, it's fine. I think it's just the fact that they can't, something is wrong, it must be seen. And that's always a tough, especially, I don't envy you in that case, to where, we would do that. The doctor I worked for, we would just kind of add it on to the end of our morning, and that just pushed us getting into surgery later and later in the afternoon, which led to late nights when people would call in the morning and go, my dog's limping. And granted, there were times where the dog chewed out its stitches, or the dog, ate its bandage, or something like that, or did something to its fixator, or that we needed to see it. Certainly, but there were times where it's just, we can't add it on, and then people get very upset, and then they go somewhere else. And
today was there were a couple other things that I know we should jump into the topic shortly, but before I went to work today, I saw someone posted on Facebook a Yahoo article about veterinarians and some dog owner who wrote to the masses, like this article about having gone to a vet who maybe she didn't really drive with at first. It's probably in the days pre-COVID or something, and she went a second time, wasn't the best relationship, and then she found another vet, and that person was great, but then kind of learned from that vet over the course of years that he or she treated her dog of all kind of like the trials and tribulations that we as vets go through in terms of like mental health issues, and the suicide rates are so high, and all this really heavy stuff that comes along with it.
Mm-hmm.
And how the vet was once seeing a blocked cat, urethral obstruction, and needed to take care of that and unblock the cat. And the owner couldn't afford it, and there was this back and forth about what can be done, as far as with the money that the owner had.
Right.
And I think at the end of that process, the vet kind of under the radar, low key, unblocked the cat and didn't charge the client. And because like all of this was just like getting very frustrated, and she just needed to do it to save the cat's life. And she did it, discharged the cat. And then I think the practice manager wasn't at the clinic that day, or somehow it got to his or her desk, and when that became apparent, decided to dock the pay of the vet and like chastise her. And there was I mean, I can't believe that, but like it happened. And
Yeah.
the craziness that that comes with sustaining a business, but also making a livelihood, and trying to do what's best for our patients. So when the owner finally realized that, it kind of put into perspective maybe the previous vet that she had met twice, it was a tough day or went through issues like that. And so it just reminds me of another patient who I didn't see this week, but there was like this whole liability with a dog that had bitten a neighbor's dog, and the owner's neighbor wanting to sue our patient, and all this stuff, and just kind of the back and forth that went between our hospital and the owner. And I think it got kind of heat. Unfortunately, finances and people are paying out with discretionary income. Like, I understand that it's difficult, and a lot of people don't have pet insurance and all this stuff, but
Right.
anyway, it can be quite heated at times.
I think it would be a great show for us to do on mental health in
for
veterinarians.
Sure, yeah,
Maybe bring some other vets in, and just have a whole bunch of people talking about, because you're right. If money was no object, then
right,
veterinary medicine would be awesome, but
exactly.
you have to pay your staff, and you have to pay your pay for your building, and pay for your equipment, and pay for veterinary medicine is on a razor thin profit margin as it is.
Mm-hmm.
And it's tough when people don't have insurance with their pets. Most of them don't, and they're having to pay hundreds and thousands of dollars for something, and you want to help their pet. Like, it's not like you're not a mechanic. You're not like, well, I can't fix your car,
right.
Go get a new car. I mean, you're talking about a living thing, and that's the line you have to walk with some people, to where I can't afford this, and you're like, I could just, and there were plenty of cases we had where we just, maybe the dog has a broken leg, or the dog has something, and we say, we need to do surgery and put a plate on it. And they go, we can't afford that. So we would just end up kind of splinting it and telling them to keep the dog confined and hope for the best, because they couldn't afford the surgery. And we can't afford to just do it and not charge them.
Right.
And because that hurts us as a business, we go out of business. Nobody takes care of the pets. And that's a tough thing. I think that would be an excellent topic to go over, and use the platform here to try to help people understand what goes on the other side of the exam table. What goes on at the vets, because a lot of people don't know. It's like you go to a restaurant, you don't know what goes on in the kitchen. You don't know who's back there screaming at each other and
and
drama.
I think the divide is even further now, because none of the clients are actually coming into our hospital.
They're even further separated from what's going on.
It's so true, and so they don't know what's happening behind closed doors. The only real exception we make, and I did, unfortunately, have a euthanasia today for a 16-year-old cat, and so the owner, we're all masked up and socially distant, so it's still a pretty strange process, but in some ways, very important that the owner can be there, obviously.
Absolutely.
But on the whole, like, everyone else, for, my dog with constipation, what's going on back there? What are they doing? Obviously, we're going to, make phone calls and, let you know it's so strange that we're, probably, several feet away. But that's the communication that we, that's safe, and that our practice is recommending that we vets use to communicate with our clients, before doing anything. And, it reminds me, one of my professors in vet school was talking about, like, how we're not at McDonald's, and, like, because sometimes I would tell an owner, like, on my clinical rotations in vet school, like, we can offer to do this, we can offer to do this test. And he's like, what do you mean? We're not offering, like, hamburger, like, fries, or I don't know, McDonald's, whatever, Happy Meals. You don't offer it. You're going to recommend this.
Right.
Like, I don't know. But, like, so, these are the things that we can recommend. And obviously that's went into my conversation this evening with the Cooper's mom. But yeah, so
excellent. Well, I think we've taken enough time with our discussion here. I really do enjoy it. It's nice, but we have to get to the topic tonight.
Let's do it.
This is our fifth show. Last week we had diarrhea. Awesome. This week we're going 180 degrees around, and we're talking about constipation. And I guess the first question we have here: what what qualifies as constipation in dogs or cats?
Sure, it's a great question. It is the infrequent or difficult evacuation of fecal content. That's how I would define it. And this is to be distinguished from an owner noticing that their dog is kind of going in circles for a few, maybe 20 seconds to just, find the right spot to defecate. That isn't necessarily indicative of constipation, but I can understand why owners would think that.
Sure.
But yeah, that's one of my the funny pet peeves of mine is if I see on my appointment schedule, dog is constipated. So that's what the owner thinks, and that it could very well be true. But when the dog arrives to me, and it's the first time I'm meeting the dog, the owner will say, "Oh yeah, he hasn't gone number 2 in 24 hours." Okay, so that doesn't mean he's constipated.
Right.
Is he having tenesmus? Is he like having difficulty straining to defecate? These are more of the things that I worry about. If he hasn't actually even attempted to go number 2, that doesn't necessarily mean that he's constipated. So yeah, I always try to ask. I think we discussed last week about diarrhea, to go kind of over all those history taking from the owner to find out, well, what exactly is going on when you say that he's constipated. Allow us to make the diagnosis.
Mm-hmm. How long between? How long, if it has it gone in 48 hours or 72 hours? Like, how long would you say, okay, now we've got an issue?
So yeah, and for sure, and they may catch it early. It's true, like maybe within 24 hours, like nothing's happened, and they, he consistently goes once a day, and their owner will know them better than we do. And so if they know there's a consistent schedule and he's off, maybe a day isn't going to be a big deal. I think over 48 hours, that's something that I, for a first time patient, it's a patient who's at a history of like recurrent episodes of, difficulty defecating, and if it's a cat that has had, especially if it's a cat that's had a history of this, then maybe not waiting 48 hours is a good idea. But I think otherwise, for a dog who hasn't had any history of these symptoms, I would say probably watching and waiting, seeing if when he attempts to go to the bathroom, if there is difficulty, because I guess the longer that feces remain in the colon, the drier and harder that they'll become, and the more difficult that it becomes to pass.
That's right. Because what's the colon's job? absorb water. And the longer it sits there, the more water it pulls out, and the harder it is for the dog to poop. I told my son I was going to tell this story, but he went through that where he would just hold it and hold it and hold it. It wouldn't poop, and then it got to the point where he was scared to go because he knew it was going to hurt because it's all built up, and we had to take him to the doctor and give him laxatives, and then he pooped out a giant nasty ball, and then he felt great. So I don't know what it is about kids and pooping, but yeah, it's the same thing with dogs. If your dog doesn't go and doesn't go and doesn't go, and then, it's going to hurt and the dog's going to be painful, and you might see some bleeding and stuff like that. And then people really freak out when there's big hard poop with blood on it.
For sure. And then, I think that there's the differentiating like with obstipation. So like that would be kind of intractable constipation, nothing that you're doing to help the constipation that you've done. And we'll discuss diagnostics and treatments, I'm sure. But, if nothing's working to treat it, those hard as rock, and they literally can be hard as rock feces, are impacted. It could get to the point where sometimes surgery is the only option, but that's
no fun.
Far down the spectrum. Yeah.
Get the glove. So what, besides just kind of straining to go and not going, what are are there any other symptoms of constipation that you can look for? Maybe like it's depressed or not eating or.
Yeah. I mean, you hit the nail on the head there. So like lethargy, depression, not eating, sometimes vomiting, especially in cats, abdominal discomfort, if you try to pick Fido up and, whatever breed of dog, however you pick him up, if it's a one-hander or a two-hander, you go into the abdomen and, maybe he'll whimper or, vocalize somehow, just, very sensitive when you touch that, the belly, that can definitely be a symptom seen with it. Those are some of the other symptoms that I would, look out for.
How do you diagnose constipation in dogs? Besides, he's not pooping. Yeah.
I mean, I think hearing the history from the owner is a huge part of it. So I would say historical symptoms of tenesmus and all those aforementioned, non-specific lethargy, GI signs, as well as, getting in there, doing a physical exam. And what I mean by getting in there, I mean getting in there with your finger. So the rectal exam is huge.
With a glove. With a glove. Yeah. Mm-hmm.
I mean, I hope that goes without saying. With a glove. and not just a glove, because a glove is going to be painful, very painful. Yeah. You're going to want to coat that with lubricants.
Oh yeah.
Don't just go, first time vet students, don't just go sticking your gloved hand in there. Make sure, you do it kindly.
That's a vet that's never worked in a clinic before. When they don't do the lube.
Yeah. I mean, so physical exam, history, and imaging. Abdominal x-rays are really good to look for impacted fecal content. Another important thing that would be done on physical exam would be kind of like musculoskeletal, and, emphasis on the spinal cord. Palpate the back, make sure there's no, pain there. If the dog has vertebral disc disease, or, if you're kind of yanking on the hind limbs, and, they're whimpering, and they're intolerant of you pulling back, then, what's the problem there? Could there be some sort of trauma? Could there be a fracture? If there's a history, the owner, fails to mention that, like I was, walking him and I accidentally backed into him and then he was limping a little bit. The limp has maybe gotten a little bit better, but the main issue is that he's constipated. Well, that's a very important piece of the puzzle. Exactly. Any type of fall or kick or something, pelvic fracture is a huge differential as far as constipation goes. And so x-rays would be useful to note if that has occurred. But exam, of course, is helpful too.
Right.
So that's a big one.
The by the way is always fun.
The by the way, it happens at least
It
once a
always solves
day.
the problem.
It
You're
really
like,
does.
oh yeah, there it is.
Yeah. And then of course, finding out what the dog's been eating and if there's been any change. Last week, or maybe it was, I honestly think it was this past Monday, dog came in for constipation. And it
Bye.
Yeah. It has a history of like bilious vomiting syndrome. So that, for a lot of owners, it's something that you notice like first thing in the morning, before eating a meal. My dog constantly is doing this, just kind of like space apart, or maybe do more frequent feedings, and high fiber diet, low fat stuff, potentially some medication like for like GI ulcers, like Prilosec or Pepsid. But anyway, this dog had bilious vomiting, been on this diet for years. The owner feeds it every 6 hours or something, and it came in bloated. And we took X-rays because like the dog didn't necessarily seem painful to me, just a little bloated, flatulence. When I pressed in on, he was a little overweight dog, and then you just hear it. Yep, all that gas in there. But the owner was away from her food, and so she fed her friend's dog's food that she was at the friend's house, and it wasn't this high fiber diet. It was literally, I think it was from. Not to speak badly about that brand, but it wasn't what the dog was accustomed to eating, and just that one feeding is what caused it. And anyway, I told her, here's some things that you can kind of do to help her out. I believe pumpkin, Miralax, and the dog's doing better. But anyway, so that's something that you need to ask as far as what has the dog been eating? Have there been any changes in diet? And that's a huge question that I ask, as well as medications, because there are a number of drugs. Dogs who've been on radiation therapy or opioids for pain. If they had some sort of surgery done and then they're on opioids, and then that's causing the.
I've seen those commercials on TV for I have opioid-induced constipation, so I have to take whatever lax to
Yep.
Exactly. So it's like the by the way thing is my lab has been his tummy feels bad. Oh, well, what's he been doing? Nothing. Oh, by the way, he ate 3 tennis balls yesterday and 5 of my socks. It's like, oh, all right, thanks. So
I say, oh, by the way, you're gonna have to wait a few hours, and then we'll he's gonna be in for surgery. So by the way.
By the way, your bill just went up. So what causes constipation in dogs? Or cats, I guess. It says dogs, but cats can get constipated too.
It's true. And honestly, I would say that of the percentage of patients that I see for constipation, I would say the majority are cats. I think that's definitely a truism. At least in my practice, that's what I've found to be the case.
Nice.
There are a number of causes.
Ooh.
Really long list that I've compiled, but I would say generally speaking, we have the intraluminal causes, so within the intestine, within the large intestine, some sort of obstruction going on. Then you have the extraluminal, something going on within the abdomen, but outside of, or not necessarily in the abdomen, but something that's going on outside of the intestine that may be compressing the intestine. And then there may be some sort of intrinsic factor like neuromuscular disease, some sort of nerve disruption, electrolyte abnormality, other general things like dehydration is a huge one. Obesity would be a risk factor. Insufficient exercise. And I guess what I'm about to say is more for cats, but over grooming.
Hairballs,
Yeah, exactly. Those are some of the main reasons. And when it comes to the intraluminal causes, it's like if dog ate hair or bones, or cat ate litter, hairballs, that mixing in with the feces, secondary to potentially being dehydrated, or stressed, reluctant to defecate because of stress or a dirty litter box for a cat, or pain or a tumor or something, that is going to lead to difficulty of passing feces.
We found that after surgery, dogs and cats can be constipated as well. We always say anesthesia puts everything to sleep, including the GI tract. So we had plenty of dogs that we would send home and say, if your dog doesn't poop for like 2 or 3 days, it's okay. Just make sure they have access to water. And after that 3 days, if they haven't pooped, then you go with the canned pumpkin and the things like that. And then we have owners that are like, he's not pooping. Give him a teaspoon of canned pumpkin. Oh, and 2 hours later, it's like, oh Lord, it all came out. It just So yeah,
it's so true.
Wonderful cure.
I mean, anesthesia really does that. I, unfortunately went through, knee surgery, and it was on some opioids, and I very quickly forgot about my knee pain for a little bit. But Miralax helps, and all this sort of stuff. But it's true. Like it does put the body to sleep, and that's what we need. The peristaltic waves. Our intestines kind of pushing the food through, and if there's any disruption in that, that is going to keep things kind of steady. And so we want some sort of prokinetic movement. That's kind of the goal with treatment.
I'd always tell people, depending on the size of the dog, anywhere from a teaspoon to a tablespoon of canned pumpkin. It's moisture. It's a lot of fiber. Although I did have clients that would say in the fall they would have a hard time finding it in the store because everybody is making pumpkin pie at that point, especially around Thanksgiving. So it's tough. So grab a can, throw it in the pantry. It's never going to go bad. And even if it goes a little bad, it's still your dog. He's going to eat it. He eats his own poop. It doesn't matter if he's going to eat a little expired canned pumpkin.
I've never run into that, but it makes sense.
I hadn't either. Yeah. 1 year, people are like, I can't find it anywhere. People are making pumpkin pie. I'm like, well, find some pumpkin pie and give it to your dog.
I think we should start doing research on eggnog, and if that could potentially, have some therapeutic effects. And then, if so, you got to store that in your freezer.
Oh yeah, you got to keep it around. You got to have it within an arm's reach in case your dog can't poop. Are there breeds that are more susceptible to constipation than other breeds? Big dogs, little dogs, doesn't matter. You said cats have it more, but
definitely cats have it more. I don't know of any dog breed predispositions. I really think that diet is really the biggest factor, more so than breed. For cats, though, there are the Manx cat does have a predisposition to sacral vertebral spina bifida, and that can potentially lead to increased risk of constipation. So anytime there's some sort of vertebral anomaly, or the aforementioned pelvic fracture, or something that could potentially be narrowing that pelvic inlet where the feces will be traveling through, lymph node enlargement, prostate enlarged, anything that's enlarged that shouldn't be in the abdomen, that's compressing feces from flowing through, that could be a big deal. And I think the vertebral issues can, of the Manx cat specifically, is the breed predisposition that I'm aware of.
Can constipation be serious? Can it be life-threatening?
Yes, it can. I have not seen a life-threatening case of constipation in a dog. I've seen it multiple times in cats. The one thing that we haven't necessarily talked about yet, and I have not heard of a case in a dog, but I'm sure it exists. But in cats, there's something called idiopathic megacolon, and it's just one of those things idiopathic. We don't really know what causes this. But that colon is going to be, it's megacolon. So it's this huge thing that it's irreversibly distended, and not like non-motile. So it's not going to be allowed, having those peristaltic waves.
Think of it as a shirt that you stretch out and it doesn't come back anymore.
Yeah, exactly.
Yeah.
It just gets trapped, and these poor cats, I've had to manually deobfuscate so many of them, and sometimes under general anesthesia, do enemas, have them on Miralax or lactulose, all sorts of, therapeutics. And, sometimes it doesn't always work, and sometimes they need surgery, like something called a subtotal colectomy. I've never done it, but that's something that can be life-threatening. Yeah.
So what are some of the treatments you would do? We've mentioned several: canned pumpkin or lactulose or keeping them hydrated. But if some dog has constipation, maybe it's non-surgical or it's maybe not so serious, what would you do? What would you recommend for people to do?
Yeah, I mean, I would say almost in all cases of dogs that I've seen where I don't believe it to be, surgical or life-threatening, I'll often talk to owners about the home remedies and kind of the things that they can do, just over the counter stuff that, you would do for yourself, if you're constipated. And I think not the number one thing, but like a very often glossed over thing is go for a walk. Or like jog your dog, especially if it's like a larger dog. Just like getting the body moving, it's honestly some of the times the best medicine that you can do, to just get moving, and that may facilitate movement of the intestines, trying to kind of start pushing things forward. So that's number one. Always making sure they have the dog has adequate source of water. Out 24/7. As you mentioned, the canned pumpkin, huge. Metamucil, or psyllium, and that can be really good for flatulence as well.
Okay.
And those are kind of the initial steps that I would take, to talk to owners about treatment. Making sure that the food that they're feeding, if it's some boutique dog food I've never heard of that, I look online and it doesn't seem to be high in fiber, and frankly, it doesn't seem to have much in terms of, good nutrients, but great advertising online.
You love those foods.
I love them. And I'll be like, here, listen, we want to switch you to the Royal Canin or the Purina EN, or, find some diet, that's high in fiber, and just start feeding this to your dog. So a diet recommendation change would be very much part of the equation there.
You're just trying to sell me a food. Yeah, you get that with the, I can't find this at PetSmart. Does it matter treating a dog, whether the dog's age, if it's a puppy versus geriatric dog?
Potential, yeah. I mean, for sure. You always, treat the patient based on what is what you can do. I will say, some patients, to do certain interventions for dogs and cats who have constipation, it can be very, very stressful to those patients. Maybe a 50-pound bulldog who is constipated will be more understanding and less likely to, buck up or to try to alligator roll on the exam table or something than a 3-pound kitten, with you just sticking your pinky or something that you could try to fit in there into the rectum. Right. And I've had the unfortunate experience good learning experience of seeing a kitten who passed away. We did 2 enemas on this poor little guy, and manual deobservation under anesthesia, because for 2 weeks he just would not go. I mean, this was really, really a severe case, and I think that there was some underlying congenital abnormality. He was only, I think, 12 weeks old, and underweight. It just wouldn't go, and it was from the shelter. It wasn't an owned cat, but nonetheless, a wonderful patient who, we did as much as we could for this guy, and we did get out so like 90% of the fecal matter, but at the end of the day, he actually passed away, and I believe went into shock. It's really truly one of the most uncomfortable things to have so much pressure in your abdomen. And even though we were able to help decrease that for sure, like probably 90%, I think it was too much for the little guy. And so you really do have to be careful with how much you are, telling the owner, like, oh, you want to do the diet, you want to do the Miralax, you want to do lactose, you want to do, if you do everything, that can really overload the system and, lead to blowout diarrhea and, the complete opposite, or end up even killing a patient. Like, I think that there's a really delicate balance. And so, just finding out what the most likely underlying cause is via, history taking and diagnostics, and then kind of treating a patient based on what is probably best for that patient. So, overdoing it is most definitely possible.
I was about to say, if you go a whole hog with everything, can you affect the way the bowels work in a pet? Can you, if you're pushing the poop through, is the body going to forget to, like, oh, I need to push the poop through, and will that lead to more problems down the road?
Yeah, potentially you can.
It's a weird thought.
For sure. Yeah.
Body's like, I forgot how to poop. What are some over-the-counter medications that you can, like, if you go to Walmart pharmacy, or you go to CVS or whatever you guys have up there, and buy over-the-counter laxatives for people? I mean, is any of that good for pets, or should you just avoid that?
No, I mean, I think it's a great question, and I don't think it should be avoided. It's, Miralax is one that I often talk to owners about, but I always preface it by, like, before you give your dog, a whole scoop of Miralax, don't do that. Call us and let us know, and we'll tell you this is how much you should give based on the dog's weight. But definitely, I mean, I feel like a lot of what we have and keep in our clinic are things that you can get over the counter.
So I've got a funny question here.
Yeah.
Sorry. Yeah.
We got a question.
No, I have one from the ones we got.
Okay.
Does constipation in dogs cause an inability to fart? We have tried to fix the constipation in my dog with a bit of pumpkin puree, which seems to be working, but now she just can't fart, and she's bloated. What would you recommend for that?
Well, I mean, I guess it depends on the patient, but yeah, I mean, I don't know. I don't really know how to answer that, to be perfectly honest. But like, flatulence is definitely something that we see. It's a clinical sign, and we look to hear what the owners have to say. What's going on? Is there a distinct smell? Is your dog gaseous? Like, have you changed the food recently? Right. And these are all things that may be leading to that. But potentially there may be the inability to do that. Yes.
Well, I'll let you off the hook there. There's if people want to go to rockwellpetspro.com and use the code constipation, you get $10 off natural dog bone broth. What about foreign bodies? We didn't mention that. Can that cause constipation? You swallow a tennis ball, it's in your intestines. I mean, you said anything blocking.
For sure. Yeah, that would be a good example of like a intraluminal obstruction. I would also expect other clinical signs as well, such as specifically vomiting, but very painful belly. And for sure, I mean, that's one of those classic things. Like if it, the tennis ball or whatever makes it down to the colon and, may,
or whatever it is, they chew
more
up
likely
something.
to get, then for sure constipation is a clinical sign that can be seen for sure.
What are some of the ways you can prevent constipation in your pet?
I think the biggest one would be ensuring adequate hydration, taking your dog for walks. Don't let him become overweight or obese. Those are, it's very simple things, but I think generally speaking, you are what you eat. And if you're feeding your dog the wrong stuff, that may lead to, adverse things. So yeah, I would, have a discussion with your vet about, what it is that you plan to feed your dog. And, if you do, for whatever reason, not follow his or her recommendations and the diet does not have sufficient soluble fiber, then, incorporate some pureed pumpkin, a little teaspoon once a day. That would be something that, as long as you're getting that source of fiber in your nutrition, be it with the food or without it, that's something that would be a really good preventative thing to do.
Well, before we wrap it up, I want to tell people again, go to rockwellpetspro.com. Use the code constipation for $10 off natural dog bone broth, which sounds delicious. Yeah, that's great. Anything else to squeeze out for this show on constipation there, Dr. Max?
You would use that expression, wouldn't you?
Well, I spent it all day trying to come up with some kind of puns for constipation. So, I tried to come up with more puns, but I just got backed up. So, yeah.
Oh my gosh. Wow. No, I mean, at the end of the day, stay hydrated.
That's right. All right, everybody. Thanks for watching. We will be back next week, same time, 7 p.m. Eastern, next Thursday night. And we will be having another topic. We don't know what that is yet. We're working on a few that I think you guys are going to really enjoy. So have a great week, and we will talk to you later. See you later, Dr. Max.
Take care, Mike. Bye-bye. Have a good night.